care.
He tried to rob him.
Board of County Commissioners now back in session. Turn it over to Michael.
Yes, sir. So as I was saying earlier, we have, now we have both companies here, a representative from Community Hospital Corporation, and Joe and his daughter Morgan, they're here from Vestra. And like I said, I would ask the board to consider deferring comments, public comments until the end of the meeting, as this is basically get to know, you guys get to know what they know, what their experience, especially with critical access with rural, doing healthcare services in Florida. And there you guys basically tell Attorney Schuler and I what questions you want us to ask them as we get into more detailed meetings with both companies. And I would ask that if we're going to do Community Hospital Corporation first, that the representative from Vestra wait out in the foyer, and I will call them in when we're ready to switch. If that's okay, we could close the doors just for this if the board doesn't mind. Can we do
It's
that?
okay. Bailiff, would you close the doors, please?
Approaching the mic is Mr. David E. Dominique from Community Hospital Corporation. And there, you do have some information in your packets from them.
If you would, please state your name for the record.
Sure. My name is David Domain. I'm with Senior Vice President with Community Hospital Corporation. As Mr. Marone indicated, we had met a couple of weeks ago just to, I guess, introduce ourselves to certain representatives here in the county. You have, I believe, electronic copies of a presentation. I also have hard copies with some additional collateral material for you guys to consider as well. Community Hospital Corporation, by way of introduction, we are a nonprofit owner, operator, and consultant to community hospitals across the country. We have been in continuous business for 20 years. We are celebrating our 20-year history this year. And our mission is to support the mission and vision of independent community hospitals, both not-for-profit or governmental facilities. If you look at slide 3, we've been around since 1996. We're structured as a 509A3 by the IRS, which essentially means that our mission is to support the mission of those not-for-profit or governmental hospitals that we serve. We have a board that we are responsible to. Historically, over 50% of that board is made up of the hospitals that we represent. So there's a very good kind of checks and balances there in terms of the types of services that we provide to ensure that it's in line with the services and the mission and the vision of the hospitals we serve. Today, we have 15 hospitals that we either own or lease. 4 of those are acute care facilities, and 11 of those are long-term acute care hospitals. We manage hospitals as well. We do that through 2 mechanisms. One, where we will provide full management and employ the CEO, CFO, and typically the chief nursing officer at the hospital. Very similar to large national management firms that you see out there. We also provide strategic support services to hospitals as well. In those cases, we've got a year-round engagement with that particular facility, but the hospital in those situations picks and chooses the specific areas of need that they want addressed. So it may be around revenue cycle, it may be around supply chain services, it may be around productivity and staffing issues, things of that nature. But in those instances, we don't employ the CEO, but we do have a year-round relationship with that hospital. We also provide consulting services to independent hospitals. Over the last 5 years, we provided consulting services to nearly 100 independent community hospitals. Most of those consulting services revolve around financial and operational improvement. We do a lot of work with financially distressed hospitals, and so a particular interest or small rural facilities, many of which are critical access hospitals. Today, we have 4 critical access hospitals that we manage or provide strategic support services to, so those are year-round relationships. One of our owned acute care facilities, and actually our oldest hospital that we've been working with for 19 years now, is a critical access hospital in South Texas. So we know this space very well. I shared with Mr. Marone a couple of weeks ago, we actually have a lobbyist in Washington, D.C., Paul Lee, who's with Strategic Healthcare, who his area of expertise is critical access hospitals. And we, just this weekend, have signed off on a new initiative where we're going to be partnering on a new advocacy program for critical access hospitals across the country. Slide 4 gives you an idea of kind of where we've worked. We are a national company. We do a lot of work in the Southeast as well. Here in Florida, if you guys are familiar with Bert Fish Medical Center in New Smyrna Beach, Florida, that was a community hospital that was trying to align with Florida Hospital at one point in time. Circuit Court judge ruled that they had violated the Sunshine Laws in terms of those discussions, and so ordered that hospital to unwind the relationship. We were the consulting firm that worked with them over a 3-year period to unwind that relationship, return them to profitability in independent status, and then ultimately help them identify and go through the RFP process for a new partner, which ironically was Florida Hospital again, but meeting all of the Sunshine Law requirements in that process. We've also worked with Central Florida Health Alliance. We actually managed them at one point in time, providing interim management services to that facility. Slide 5 gives you an idea of the consulting services that we provide. I won't go into all of these, but suffice to say, we have about 75 employees in our corporate office in Dallas, Texas, and they touch every area of the P&L statement for the hospital. So there's a lot of firms out there that are, 3 or 4 or 5-man shops. That is not us. We provide these types of services to the hospitals that we own and lease, and we also provide these same services to the hospitals that we manage and consult with. Each of our relationships, long-term relationships, whether we own or lease a hospital or manage a hospital, we start with a full operational assessment of the facility. And so that's an opportunity for us to identify any cost reduction or revenue enhancement opportunities that may be at that facility. For governmental hospitals in particular, a lot of times we'll see areas of opportunity around productivity and staffing. We'll see opportunities around supply chain and/or revenue cycle services as well. Those are typically kind of the low-hanging fruit, if you will. For critical access hospitals, a couple of things that we look at in particular. Are they utilizing the 340B drug program? Are they utilizing USAC funding for telecommunication services? Are they utilizing swing beds in their particular facility? Those 3 areas, if you're a critical access hospital, you automatically qualify for all 3 of those types of programs. And in most cases, if a hospital is not utilizing those services, they're leaving money on the table. And so as we look at Weems Memorial, certainly there's some challenges associated with the facility, but we do see opportunity there as well. We're very flexible in terms of how we can work with a hospital. We don't have a one-size-fits-all type of approach. As I said, in some instances, we'll own and lease the hospital. In some instances, we'll manage, and in other instances, we'll provide that year-round strategic support services. Part of our due diligence is to determine what is the appropriate structure that makes the most sense for, in this case, the county, potentially Tallahassee Memorial as a strategic partner, as well as Community Hospital Corporation. The next few slides are just some case studies. I won't go into these in detail, given the time limitations, but feel free to take a look at those. We can provide references at the appropriate time as well. And I guess I'll open it up to questions if you guys have specific questions.
Any questions from the board? I don't have a question, I have a comment. Looks like a lot of the services that you have the expertise in providing are a lot of services that we need as we've been dealing with this hospital for a number of years. as it relates to a lot of different services. Let me get back to the right page here, and I can name out just a few of them real quickly. Was the let me see where I was at. But all of these things really, interim management, information technology, electronic medical records. I mean, there's just a host of things that y'all actually come in and look at, and things that we need help in those particular instances, and pretty much everything you got here. Meaningful use is another one that we've been dealing with here as a board. Just a lot of different things here, and
Mr. Chairman, if I may, just one specific example. I mentioned USAC funding and that telecommunications program. That's a very little-known program offered by the federal government. USAC is Universal Service Administration Company. On your cell phone bill, there's a line item that goes to provide federal dollars for hospitals and educational type institutions in rural areas across the country. We've got a program where we work with hospitals to maximize that USAC funding program. The Critical Access Hospital in South Texas that I mentioned, our longest standing client, 1 year we actually secured over $200,000 in reimbursement through that federal program. There's a cap of $400 million in that program. Historically, they have never reached that cap because very few people knew about it. But because we work in critical access hospitals and small rural hospitals on a day in, day out basis, those are the types of programs that we know to tap into, because $200,000 here, $150,000 there, I mean, those are things that keep critical access hospitals in particular alive.
yes.
What's your closest office here besides Texas? I mean, is it one in Florida or what's,
I'm sorry, can you repeat that question?
your home base is in Texas?
Yes, sir.
You have one in Florida office?
We do not. We have a Southeast regional manager that's based in Chattanooga, Tennessee. And so all of the hospitals, and we've got a critical access hospital that we provide year-round strategic support services to in Georgia, Wills Memorial Hospital. We've got a couple of hospitals in Kentucky and that he's responsible for as well. And then this would be part of his region as well. But historically, we have worked in the state of Florida.
Any other comments from the board members?
I just have one question, Mr. Chairman. Has your company ever worked with AHCA, Agency for Healthcare in the state of Florida, before?
We have, in particular with Bert Fish, through that transition. That was a pretty hairy engagement, to be perfectly honest with you. We were brought in a year after the hospital had aligned and affiliated with Florida Hospital, and so we had to go in and basically unwind that relationship. They had merged IT systems, they had commingled assets between the two facilities, so there was a lot of work just in terms of pulling those programs apart. And so working with them through that process, as well as the new change of ownership through the new RFP process, took a lot of involvement.
Any other comments from the board?
I want to add something. The three that are on the map for Florida,
Yes.
what are those locations?
So one is Bert Fish in New Smyrna Beach, and then there were two hospitals affiliated with Central Florida Health Alliance. So those are the three facilities there.
Any other comment?
Yeah, do you think we got any light at the end of the tunnel?
We've just kind of started. We received the financials from the hospital this past week, so we're in the process of reviewing that information, some operational statistics, some financial statistics. I get asked that question a lot across the country, can our hospital survive? A couple of things that I will say. One is that you've got some good things going for you, and you've got some challenges, and I know I'm telling you things that you already know. You've got an average daily census of 2 over the last couple of years. It's really hard to sustain a hospital with so little admissions. But you are critical access. You do have a tax base. I think if Tallahassee Memorial can step up and provide some rotating physician coverage here, that would help with admitting and the daily census there at the hospital. Those are things that we look, and let me back up a step, because anytime that we enter into a relationship, whether it's a lease relationship or whether it's a managed relationship, we identify a tertiary partner, and tertiary being a larger, more sophisticated health system, to partner with the small local rural community hospital, because they can do things and provide services through an affiliation that are very beneficial to the smaller institution. One of those is they can rotate physician specialists through that community on a, every other week or once a month or whatever the case may be. They can provide training and staff development. They can do a lot of clinical program development at that tertiary level. Our expertise is around the operational improvement. And so we always look to kind of marry what we do well with the appropriate tertiary partner in the market also.
Any other questions? We do appreciate you coming in, introducing yourself to the commission here, and look forward to you working with our staff as we
Appreciate it.
move forward on this endeavor.
Thank you very much.
Thank you.
No, you're fine. You good? You good?
Mike, real quickly, we don't have any information from this particular.
No, because we just met yesterday.
Okay.
They weren't able to provide a packet of information, but they'll probably forward something to me later.
Okay.
And I'll add it to your agenda package.
All right.
Well, first off, thanks for having us. It's been a while since I've been in Franklin County. It hadn't changed much. It's very, very beautiful. First, I want to introduce myself. I'm Morgan Dunn. I'm president of Vestra. We're a rural hospital company, rural health company. This is Joe McNulty, and he is the director of operations for Vestra as well. First off, I'm sorry we don't have a formal presentation. It's kind of late notice, but with spring break, I have 3 kids, so we were out all last week. I wanted to give you guys an idea of our history and our experience, and then pinpoint some of the key initiatives that we think are important to success for a primary care delivery system in rural Franklin County, rural Florida. I think it's important to understand who we are. We're from a small rural town. I live in a town of 4,500. As Mike pointed out, and this is my father, it's already out of the bag. We tend to not say that to too many people just because I want you to have your opinion about me without it being my father. But we live in a small town of 4,500. And I think it's important to understand the passion behind it. So I'm going to tell a quick story. 2 years ago on Mother's Day, we're cooking out. It's a Sunday, and I have, like I said earlier, 3 kids, a 10-year-old at the time, an 8-year-old, and a 5-year-old. And he's grilling salmon, and my 10-year-old eats it. And he has an anaphylactic reaction, which is a severe allergic reaction. We're about 3 minutes away from our local ER. Again, small town, closest ER is 30 minutes away, if you're lucky without traffic and stoplights. So we jumped in the car. By the time we made it to the ER, his throat was already closing up. Now, if you don't live in a rural town, you don't understand the importance of having that emergency room, of having that healthcare locally. I didn't call the ambulance because I knew by the time the ambulance was going to get there, it was probably going to be too late. That passion is what drives us to make rural healthcare work every single day. And it started back in 1989. We started managing and consulting with small rural hospitals. Obviously, we know that critical access was not a part of the world in 1989, but in 97, when the Balanced Budget Act came out, we really started pushing for the critical access movement. We actually converted the first 2 critical access hospitals in the state of Mississippi. Since then, we've worked with approximately 40 critical access hospitals throughout the United States. So our experience is deep. We've provided consulting and management to multiple critical access hospitals regarding hospital operations, service expansion with geriatric inpatient psych programs and outpatient geriatric psych programs, physical therapy, general surgery. So I think it's important for you guys to understand what you're getting with the experience that we bring to the table. I'm going to make it sound really simple for rural healthcare to be successful in Apalachicola. There are very few things that make it successful. The first and foremost important thing is providers. You got to have doctors. You got to have nurse practitioners, physician assistants. You got to have them. That is the first thing we would focus on getting here. Getting rural health clinics. We've worked with 40 rural health clinics, provider-based rural health clinics with the critical access hospitals, roughly 7. So we've had 40 provider-based rural health clinics that housed 50 nurse practitioners or non-physician practitioners and roughly 30 physicians. So our knowledge of what really works in primary care around your provider community is what you really need to start stabilizing the healthcare delivery system here. It's the only thing that's going to make it happen. You're not going to be able to do it through your ER. You're not going to be able to do it through just happen chance. You got to have a solid primary care provider network here locally. That's the first thing. Once we get that primary care delivery system, the providers, and they're on board with the local facility, right? They're employed by the hospital, or they have a joint relationship with the hospital. Then we start adding services to the hospital. Then we start partnering with Tallahassee Memorial, working with them from a quality delivery system, allowing them to bring specialists. Because the thing is, you have to understand about a large health system. There's not very many people here in Franklin County compared to Leon County. The revenues that are brought in to a Tallahassee Memorial, your hospital is a drop in the bucket. That focus that Tallahassee has, a rightful focus on their local facility. So we're going to look at partnering with Tallahassee where the partnership, it comes in both sides. We keep primary care services here. They bring specialists here to support the primary care services here. And then we send our referrals. We have a referral network to Tallahassee. We work on expanding access. For example, the CareBell Clinic. Great clinic. We drove by at 5:15 yesterday. Not a soul in the parking lot. We got to expand those hours. We have to provide access. You can't close. You can't work from 8 to 5 and expect access to be provided here locally. They're going to go somewhere else. They're going to end up in your ER for the sniffles. So we have a lot of service impacts that we can provide here locally. And then we start adding to them. We start looking at what the population needs here in Franklin County. And we work with partners like Tallahassee Memorial. So when we start building that service area, when you start building up the services, what are we going to need? We're going to need facility updates. So it's important to know that in our experience, we've actually fully replaced a $15 million critical access facility, fully replaced it about 4 years ago. And we've also had a $7 million renovation, total hospital renovation. And we've done multiple operating room updates, ER updates, medical office building, replacement facilities, and new projects. We've even done pharmacies in our local communities. And I know that you guys have a really big project on your hands. I think, what, $10.5 million? Time is ticking on. We have that experience to shepherd through. You don't need a Taj Mahal here, but we need primary care services and primary care facilities that we can put into the community that works for the community. It's a very simple approach, but it takes passion and it takes effort. And it takes constantly moving every single day in the direction of getting primary care services back here locally. Recruiting doctors. Just because you have a doctor, let's say we recruit a doctor in the first 6 months. That doesn't stop our efforts on recruiting a doctor. Turnover is massive. It's that constantly recruiting, constantly trying to get more providers locally. We have the experience to make your healthcare delivery system work here. We do. We have a track record of being successful with it. I know it's been a short presentation, and I appreciate you guys having us here. So, thank you.
Any comments from the board?
Where y'all out of?
McGee, Mississippi. Small town.
What kind of turnaround you think you're talking about?
Oh, that is a loaded question. I think, I'm not gonna put a time frame on it, but it's all about your providers. We have to get providers here, because until you're not gonna have a turnaround unless we have doctors and nurse practitioners here. It's the only way it's gonna work.
Any other comments from the board? We do appreciate as a board you coming in today and making your presentation. And we look forward to you working with our county staff here that's been directed to conduct the interviews and go through the different scenarios, and they'll bring their findings back to this board. But we do appreciate you being here today to present on a short notice, of course, but it was just time for the board to listen to some of y'all's comments and get to know you as we move forward on this endeavor that we're trying to tackle here now. So thank you again for coming in today.
Thanks for having us.
Thank you.
Thanks.
Appreciate y'all coming.